This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, Christie sent a message saying, thanks for your information. I'm answering, you stated why she did the long protocol earlier. She says, because my hormones responded slowly to stims to gonal F and standard IVF, I have a high AMH and would get only about 5 mature eggs and poor fertilization. We did Menopur and long protocol and I responded better and got 20 eggs and more fertilized. I would only get 1 embryo and none to freeze. I have a few frozen now. I don't know if it was Menopur or long protocol that I got better results. That's why we did the long protocol.
Yeah, interesting. Yeah. PCO can be difficult and sometimes, and we're always reluctant to give a strong dose of medication because of the risk of hyperstimulation. And I suspect that's probably why you didn't get particularly good response. It's probably Menopur has the LH extra to gonal F. It shouldn't make a difference in PCOS theoretically, because in PCOS you have elevated or relatively higher H levels anyway. Yeah, not sure. I suspect they may have used a higher dose of Menopur than they did of the gonal F.
We have a question from Kimberly who's online. She says, hi, Prof. Good to see you. I've been a few times looking to get back into my treatment. If I was one of your patients, would you be requesting a medical clearance from my specialist team? I am the one with the microadenoma and stopped to get those levels under control and wait.
I think if they're under control, I'd be comfortable knowing that you have a specialist looking after that aspect of your care and work in parallel with them. Yeah, I don't think you need a full medical assessment. Microadenomas, once they're controlled, are under control. During pregnancy, once we get you pregnant, then we've got to keep an eye on what's happening with them. But in the lead up, if provided the prolactin levels are in the normal range, I'd be comfortable moving forward. In terms of weight loss, obviously the least weight you have, the more chance there is of pregnancy. When I say that, it doesn't make a huge difference. And we've just delivered a lady who's 130 kilos for an IVF cycle. So women still get pregnant even when they're overweight.
Okay. I've also shared your number again in case it's needed by people who've just joined, because I don't know if it shares the details when, for people who haven't joined earlier. Prof, how does the experience of IVF differ for single parents, same-sex couples, or older individuals? Do you have any thoughts around that?
Well, as I said earlier, the world has changed from a financial point of view for single women and gay couples. They're now getting Medicare rebates for their cycles. That's a whole range of different people. I've already talked about older women earlier in this session. Obviously, if you're a single woman or a woman in a gay relationship, you're going to need donor sperm, and that's a whole process in itself. Again, like Philly Sydney, we have donor sperm, and we are very comfortable having women in that category come to see us.
Prof, could you talk about any innovations you're aware of that are helping improve egg and sperm quality for IVF?
No. No. And if we knew that, we'd be doing it for everybody. And as I say to my patients when they ask me that question, if we could discover that, you and I would be billionaires within a week. Everybody's asking the same question, because egg quality is what determines the chances of a pregnancy. And we know that egg quality declines with age. And unfortunately, society has changes in society have moved at the time at which women are looking to have a baby to be much older than they were a decade ago. So there are no magic bullets, I'm afraid. Nobody's come up with anything that really makes a difference.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.